Small things keep Ian going. A stove for a cup of tea, fairy lights for his cardboard home, and a bit of humour on the walls. But life under the A4 in West London is hard. Ian's mental health is as precarious as his makeshift shack. In November, he was back out on the streets after being released from a psychiatric ward. And after 12 years clean, he's back on crack and heroin.
So I started dabbling probably 4 or 5 weeks ago, but relapsed properly, as in when I realised I had my habit back about 2 weaks ago.
What caused that? What?
Just being messed over in general by the services, you know. They've proper had me. They was meant to have me rehoused and they didn't, you know. I'm meant to have meetings with my care coordinator once a week. I've not had one meeting. I've spoken to her not even 5 times, I don't think.
Ian embodies a prevalent issue among the homeless community. In the general population, 12% of people have a mental health problem. But a recent report by Homeless Link found the number of homeless people diagnosed with a mental health problem has soared from 45% of people between the years of 2012 to 2014 to 82% of those homeless between 2018 and 2021. 45% of those self-medicate with drugs or alcohol. Increasing numbers are unhappy with the level of mental support. 20% said they received no support at all. It's hard to illustrate this decline among such an invisible population. But one thing about Ian helps. We've met him before. In 2020, during the pandemic, he was living in a hostel and even then was feeling unsupported.
You get mentally unwell, you get sectioned, you get put in hospital. They tell you, hey, when you get out, you're going to have a community mental health team, you're going to have a care coordinator, we're going to put these things in place. You get out, you don't hear anything from them. Literally, it just stops. There's been times before where I've been sectioned and I've got out of hospital and I've been okay for a day or two, and then I've just relapsed because there hasn't been anything there to catch you when you're coming out. Spare a little change, please.
Ian's decline in 2.5 years is visible. The vicious cycle he described continued. At rock bottom, he was sectioned again and again. Any progress was undone when, after being discharged, he ended up back on the streets.
What's your coldest nights like in that house? Because it has been getting colder even before this.
Yeah, it's been pretty harsh. I know someone died on Shepherd's Bush Green the other day as well. Someone passed away.
What, just too cold or
yeah,
overdose?
Just sleeping on the ground. Just died in their sleep. So, no.
Do you worry about that when you go to sleep?
Death doesn't bother me.
Doesn't bother you?
Doesn't bother me.
What, if you died in your sleep, it wouldn't bother you?
No. Sadly, no. No, I wouldn't.
Why not?
Good question. I don't know.
Ian's case raises many questions. Brent Council, who last housed him, said, "We have tried to help and support Mr Harrison, who feels unable to return to his home in Brent. He has turned down an offer of emergency accommodation and we lost contact before other offers could be made. Our priority is to see Mr Harrison safe and well. We are keen to meet Mr Harrison as soon as possible to ensure he gets all the help and support he needs." Under emergency winter measures, Ian has been found temporary accommodation. He says maybe next year he can break the cycle. Jason Farrell, Sky News.